Hey, if you got type 2 diabetes and someone in a white coat, kind of like this, looked at you in the eye and said, this is just something you're going to have to manage for the rest of your life, I need you to hear me on this, okay? That might be the single biggest lie keeping you stuck right now. And look, I'm not saying your doctor is a bad person, and most doctors are doing their best they can inside a system that's flat out broken, all right? But here's the thing nobody says out loud. That whole system is built to manage diabetes. It was never built to reverse the thing that caused it in the first place. There's a big difference between that. So, in the next few minutes, I'm going to show you exactly what the difference is and what you can start doing about it tonight. All right. Real quick to start off, so you know who you're talking to. I'm Dr. Jonar de Guzman. I'm board certified physician. I'm a diabetes reversal coach. And this is the part that actually matters. I used to be the guy on the other side of all of this. All right. I was 40 plus pounds overweight during medical training. My A1C was creeping right up into that pre-diabetes range. And, I was scared. So I get it. I'm not lecturing you from some pedestal above. I climbed out of this myself without medications, without giving up carbs forever. And now I help folks do the same thing. And so here's what usually happens. And tell me if this sounds familiar. You go in for your appointment, they check your hemoglobin A1C, that's a marker for diabetes. You get a prescription, or they bump up the dose. Okay. And they tell you, hey, just lose some pounds, eat better, maybe cut the rice, right? Cut the noodles out, cut the bread out, come back to me in 3 months. But nobody hands you a plan. Like nobody tells you what to eat exactly, besides that generic cut the carb advice, when to eat, how to move, how to sleep, how to better manage stress, how to read your own numbers properly. So you walk out that door with a little more fear and basically zero direction. And that's not your fault. That's the gap I want to close today. All right, I'm going to talk you through the 5 truths that flip the whole script on type 2 diabetes. All right, let's go. So, number one, truth number one. The lie was never that diabetes is serious, because it is for real serious. Okay. If left uncontrolled, though, it can mess with your eyes, it can mess with your kidneys, it can mess with your nerves, your hands and your feet, it can mess with your heart. And I'm not going to sugarcoat that, pun fully intended. All right. The lie is that it only moves in one direction. You know the story they tell. They diagnose you. Then it's meds. Then it's more meds. Then it's complications. Like it's a one-way street and you just got to brace for the ride. No, that story's incomplete. Here's what they leave out. Insulin resistance, which is the actual engine under the hood here, it responds. It responds to your food, it responds to your sleep, your stress, your muscle, your movement. So change those inputs and the signal can change. Your body can start listening again. And I know somebody out there that's thinking, but Dr. Jonar, it runs in my family. Okay, yeah, real talk. Same here. Family history loads the gun. All right, yes. But your lifestyle, your environment, that's what pulls the trigger. Genetics is not a death sentence, it's not a life sentence. It's a risk factor, just as your lifestyle is a risk factor. So think about it like this. Picture a room filling up with smoke. You can run around opening windows forever, trying to clear it out, or you can go find the fire. Medications, that's opening the windows. It clears the smoke, and sometimes you need that. But the reversal asks where the fire's coming from so you can put it out once and for all. And so you got to ask yourself one honest question here. Have I ever actually been given a reversal plan, or just a plan to keep watching the smoke? And that right there is where most appointments fall apart and fall short. All right. Truth number two, and I want to be careful here because I love my fellow doctors. I am a fellow doctor, right? But we got to be honest with ourselves here. Your average doctor's visit is what? 7 minutes, maybe 10 if you're lucky. And in those few minutes, your doc has to review all your labs, renew your prescriptions, figure out what happened last time, if there's any new problems that popped up, screen for any complications, type up the whole visit, and then get to the next patient? You tell me, how is any one person supposed to coach you on meal timing, coach you on sleep, on managing stress, building muscle, cooking, for example, your cultural foods in a smarter way, and reading your glucose patterns all in 7, 10 minutes? They can't. It's not because they don't care, they do, but it's structural, it's a system. The 7 minute, 10 minute appointment, it cannot rebuild a 24-hour life, period. Okay? It's like somebody telling you to renovate your entire house, and the only instructions that you're given is keep it clean. Cool, yeah, that's true, but that's not a blueprint. You can't build anything like that. So here's my ask, okay? Don't walk out of there frustrated at your doctor's office, all right? Walk in with better questions. You got to ask them, what's actually driving my insulin resistance? What would tell us if it's getting better? What's the first thing that I should change? The different questions will get you different answers. And that leads us straight into the most important shift in this whole video. Okay. And real quick, if any of this is already making you go, wait, why has nobody told me this? Hit that subscribe button, please. This channel is for folks like you who are sick of being told just to cut the carbs, just lose some weight, just take the next pill, with nobody explaining to you ever how and why underneath it all. Okay. I drop videos every week on lowering your A1C, reversing insulin resistance, and getting your food freedom back without living on some miserable extreme diet. All right. Okay. Let's get back to it. This next one's the big one here. Truth number three. And if you only remember one thing from this whole entire video, make it this one. Blood sugar is the symptom. Insulin resistance is the root. Okay? Say it with me again. Blood sugar is the symptom. Insulin resistance is the root. Okay? The numbers get all the attention, right? Everybody's obsessed with the numbers, but the numbers are the dashboard light blinking on your car. You don't fix a check engine light by smashing the light bulb. You pop up the hood to look underneath, right? And so here's what's actually going on. When you eat, your food turns into glucose, that's sugar, and that gets into your blood from the gut, right? And insulin that's made by the pancreas is the key that's supposed to unlock your cells and let the sugar in. But when you have inflammation and, for example, extravisceral fat, that's the fat that wraps around organs, building up, that lock gets rusty, it gets mucked, like it gets clogged. So that same key, it stops working. Your cells stop listening, the doors don't open, and guess where the sugar goes? It stays in the blood. That's insulin resistance in a nutshell. So if you only chase the numbers, if you just slam your carbs down to nothing to make the numbers look pretty, you might never realize your body is still struggling underneath. Okay. There's even a name for that. It's called carbohydrate intolerance or carb intolerance. Okay. The numbers look good, but you didn't fix a thing. You didn't fix the thing underneath, right? This is also why two people can eat the exact same plate of food and get two totally different blood sugar responses. The food matters for sure. All right. I'm not saying that it doesn't, but the body receiving the food matters just as much. So flip the question. Stop asking, how do I get my numbers down? Start asking, what is making my body resistant to insulin in the first place? Okay. And once you see it that way, the whole role of medications starts to look real different. All right. Truth number four. And I need you to hear me clearly on this one here because people love to take this one out of context. I am a physician, a medical doctor, okay, an MD from a medical school here in the United States. All right. I am not anti-medication. And I'm going to say this again. I am not against your meds. Medications can actually protect you. It can bring dangerous blood sugar levels down very fast, amongst other slew of medical illnesses, whether they're acute or they're chronic. Okay, it can buy you time. That's real and that's valuable. But here's the problem that I have. The problem is when the medication becomes the entire plan, where people, doesn't matter if it's physicians or patients, we think pill for an ill. I have a pain. Oh, let me take this medication. So we rely heavily on medication first when your dose keeps creeping up every couple years and nothing else in your life changes. That's not reversal. Let's call it what it is here, guys. That's managing your decline slowly. You know, meds can lower your blood sugar, yes, but a pill does not rebuild your insulin sensitivity for you. It doesn't teach you what to do at breakfast, for example, or at lunch. It doesn't help you at that family party when there's a mountain of food in front of you. Okay. It doesn't fix a night of eating garbage before bed or garbage sleep itself. So here's the move. Okay. Please don't get this twisted. Do not stop your medications on your own ever, please. You keep taking what you're prescribed, but you also go to your doctor and you ask, what lifestyle changes could safely lower my need for this medication over time? Okay, it was never meds or lifestyle. Okay, that's the wrong sort of thinking and question. The right question is, how do we use every tool we've got intelligently while we go fix the actual root of the problem? So, what does fixing the root actually look like? Let's just bring it all home. Okay. Truth number five. All right. And this is the heart of everything I do. Your body is not broken. Say it with me. Okay. Your body is not broken. Your body. All right. It's just been getting the wrong instructions, the wrong manual for years. Okay. Processed food of our modern world, chronic stress, not enough sleep, not enough movement, not enough muscle, visceral fat just piling up, blood sugar spiking all day, all night. Your body's not failing you. It's not. It's just responding ever so perfectly to terrible conditions. Okay. Think about a plant, right? Think about a plant that's wilting. You don't stand over it going, what's wrong with you? Why are you so weak? No, you check the soil. You bring it under sunlight. You give it water. You change the conditions, and then the plant comes back to life. Same with you. So in my diabetes reset protocol, we change the conditions through four simple levers. Okay. I'm going to go over it with you really quick. Eat, eat real food, more fiber, more whole foods, less processed foods, smaller portions, in order in which you eat your food, veggies first, then protein, then carbs if you're going to eat it, rice, for example. Same meal, totally different blood sugar response, okay? Number two, reshape, okay? Number two, reshape. Move your body. A short walk after you eat to blunt that post-meal blood sugar spike and build a little muscle because Muscle is where your blood sugar actually goes to get used up. All right. Number three, transform. Okay. Get your stress and your food noise under better control because stress is a direct trigger for increased blood sugar, but it also causes other unhealthy habits like emotional eating, stress eating, staying up late at night, doom scrolling. This is the part that everybody skips and forgets to address and work with. And last but not least, sleep. That's number four. Okay. 7 hours. This is non-negotiable, people. Every hour you lose under that seven just cranks your insulin resistance right back up. All right. And that's it. Not a hack, not a fad. This is not ketogenic. This is not carnivore diet. This is not 100% vegan diet or simply starving yourself. Okay. Four pillars working in together, changing the conditions your body's been stuck in for years. All right. I'm not going to leave you with a bunch of theory and a good luck. Here's what you do tonight. Okay. Tonight, four things. Number one, finish this sentence out loud. I've been managing my numbers, but the root I actually need to deal with is fill in the blank. Hint, hint, inflammation. Okay. Number two, pick one lever that I talked about for the next 7 days. Just one meal order, for example, a 10-minute walk after dinner, your sleep window. That's it. Don't try to overhaul your whole life by Friday. That's how people burn out and then they quit. All right. Number three, track one thing every day. Maybe it's your fasting blood sugar. Maybe it's your energy. Maybe it's your cravings, your sleep. Just notice, okay? Because data is power for us. And finally, four, I am a doctor, but I am not your doctor. So if you're on insulin or any glucose lowering medication, any diabetes medication, talk to your doctor before you make any big changes to your food or to your life. Always, okay? Always, always. And that's how you go from waiting around for a rescue to actually grabbing the first lever you can control. Okay, that shift from passive to powerful, that's where everything starts. All right, so let's just go back to that lie one more time. The biggest lie about type 2 diabetes was never that it's serious. It very much is. The lie is that you are powerless, that managing the decline is the best you can hope for. That is a bunch of baloney. That your future's already written. That's bogus. It is simply not true. Your body is responding to conditions. And when those conditions change, your body can respond differently. I've watched this happen time and again with hundreds and hundreds of folks. That actually started with myself. That actually started with me. I watched it happen with me. And if you want the actual framework for changing your conditions, and if you're ready to stop guessing and actually figure out a concrete, flexible, and practical plan, head to my website for truthhealthcoaching.com/call and book a diabetes reset assessment with me. We'll sit down, we'll look at where you're at and see if this is a right fit, okay? No pressure, just a real conversation. You've carried this for far too long, so let's figure it out together, all right? I'll see you on the next one. Peace.